Hi, I'm Vanessa Lee, registered nurse, top aesthetic injector, and a trusted authority in the world of beauty and skincare.
I'm Nurse Janet, aesthetic nursing director at The Things We Do, and trainer and mentor to new and future injectors. Welcome to the podcast. Join us as we cover all the things we do for beauty, weird shit included.
This episode is sponsored by The Things We Do. Come visit our locations in downtown LA, Venice, Chino Hills, Beverly Hills, and coming soon in Oahu. You can also inquire about our appointments and get a feel of what we do through our IG and TikTok at thethingswedo.co, or simply stroll on into the beauty bar and pick up all of your skincare essentials. We want to hear from you. Please send us a DM on our IG at thethingswedo.co with your questions and comments, and we will be choosing a listener to shout out and have their questions answered on upcoming episodes.
This episode is about when you should start getting aesthetic treatments and how often you should be getting them.
Let's start off with Botox.
Yes.
I think the important thing with Botox to understand, Botox is a neuromodulator, first of all, that there's a few different neuromodulators on the market to choose from. So there's Botox, there's Dysport, Xeomin, Jeuveau, and most recently Daxxify. Yes. So Botox is more of like the household name. It is the most studied and is the longest FDA approval, I think, was the first one in the U.S. To get FDA approval. So we commonly say Botox, but we're referring to neuromodulators. Botox can be used for wrinkles and addressing fine lines in skin because of the dynamic movement of the muscles underneath the skin. And they can also be used to position muscles in a different way. So for instance, the bulking of the masseter muscles to slim that down. The lifting of the brow muscles, that doesn't necessarily have to do with wrinkles, but it's something that we can pull off with neuromodulators. So let's get to it. When did you first get your first Botox treatment? And was it Botox?
It was Botox.
Okay.
I first got Botox when I was, hold on. I think I was 22 or 23 years old.
Yeah.
What about you?
Say 23.
And
we're sick.
I want to, no,
we're not sick.
I want to say that I became a nurse, just like you. I think we became a nurse like fairly young.
We have the same story.
Yes.
We both had to have Botox placed into our systems because we needed to know how to explain it to our patients.
Yes.
What our experience was. So we're not sick. I was joking. We're kind of sick.
But also, like, just like you, I worked at the hospital, and we would chart so much. And I don't know about you, but I was charting like this.
Frowning.
I was frowning.
Concentration face.
And so I started seeing like a very faint line here. And that's when I was like, oh, maybe I should dabble in Botox a little bit. And that's what introduced me to Botox. So yes, on paper, it seems like I was very young, but there were things that I started noticing at a young age that probably some people notice even sooner. Like I have some patients who are like 20, 21, and they genetically get it from mom or dad, just a very strong, hyperactive muscle. And I have other patients who are my happy little birds and they don't frown at all. And they're 35, 40, 45 years old and it's so faint and they barely start at that age. So yes, it may seem young, but it was a necessity.
It was a necessity for me. It was for you.
I had to. That's how I justified it.
It wasn't, and I didn't see it as something that I absolutely needed it at that time. The doctor that I worked with was like, Vanessa, our patients are in their 60s and 70s. And
God.
You're over here at 23 years old and you're Filipino, so you look like you're 16 years old. You need to make sure that you can connect with these patients. And it's not going to be through life experience because you don't have that. You need to have the treatment done. He was so sweet, Dr. Beltran. He was like, you need to have it done just once, humor me, so that you can let the patients know, yes, you've had it done. It's in your system. This was your experience. This is how long it took for it to set in. And that's that. And you don't ever have to do it again. And then I did it that one time and I was like, oh, I'm prettier. Yes. And I was like, oh my God, this is great. You get a brow lift with this?
How many units did you do? Do you remember?
I started off with 20, I think.
Oh, good.
And it was just in between my eyebrows. So I adjusted a little bit. But if you know what Botox does for you, it doesn't just relax the muscle underneath and minimize the fine lines that you have. It also does the opposite to whatever that natural muscle pull is. So in between the brows, that muscle group is a depressor muscle group. So it pulls inwards and downwards. So when you place Botox into that muscle group, it lifts that inner brow area. So for me, I was like, oh my gosh, what is this? Like I have a little more space in that zone now and it looks fantastic. And I was like, where else can we put this in my face? And so I ended up doing my forehead, my crow's feet, you know, and like later on I started doing like my masseters, my chin, my DAOs, my upper lip. And I realized quickly that some of those procedures were not for me and that I needed to not do those treatments in my face. I didn't look great with them. And that's how it started. But I think that figuring out when it's right for you as far as like starting your Botox journey or your neuromodulator journey is to realize that yes, preventative Botox works. Like if you're starting to get these fine lines, if you start doing them now, they never get worse in the future as long as you keep up with things. And, you know, people tell me all the time, like, oh my gosh, you have no frown lines. So I'm like, they never had a chance, baby. Like,
I never gave them a chance.
I never gave them a chance. I've been doing this since I was 23. And like, yeah, if you're watching us on YouTube right now, like I'm frowning in between my brows. There's definitely movement there, but I'm never going to have like the deep demarcated lines as long as I keep up with this stuff. I think it's appropriate for every person to consider starting if you feel like those lines make you look sad, mad, and tired, and you're not, and you want to do something about them. And you've already tried using retinols, you've like done the facial massage, all of that stuff. It's not doing anything for you. Then it's a good idea to look into your first Botox appointment.
Yeah, and if you decide it's just not for you, they don't get worse because you now treated yourself with Botox. The muscle wakes back up and then it starts moving like it normally does.
And then the lines come back.
Yeah. So as far as what's the correct age to start, I feel like it's a very decision.
Different for everyone. Yeah. For I think most people who come in who are starting their Botox journey, it's usually around the time of the late 20s and early 30s.
Yeah, I agree.
Is what's typical, I think, within the things we do. And then as far as upkeep, once a season. So
every 3 to 4 months.
Every 3 to 4 months.
Yeah.
I've stopped. So I've had Botox in my system since I was 23. I'm 38 now. I've stopped using Botox 3 separate occasions when I was pregnant and nursing my little ones. So that was anywhere from like 18 months to almost 2 years. And each one of those times, I just slowly noticed my muscle movement going back to normal and then the lines starting to demarcate into my skin. So the fine lines starting to show up very lightly. And then once I stopped breastfeeding, I continued my Botox journey again and it was totally fine.
Yeah, I agree. Nothing ever came back worse.
Yeah.
If anything,
the worst was better prolonged. than you were at your baseline
because you've
before.
Been doing it so consistently. Mm-hmm. Yeah.
Now
let's dive into.
Oh, go ahead.
Now let's dive into skin treatments.
Yes. So skin treatments are anything that really works towards improving your skin health and rejuvenation. So we're talking about different forms of microneedling, which are microneedling with radio frequency, which is our Vivace that we talk about. It can also be traditional microneedling with a microneedling pen. It can also be microinfusion with a stamper. And other skin treatments are, facials. Chemical peels, Sculptra treatments, biostimulatory treatments like PRFM, Sculptra. Smooth threads, which are collagen inducers and skin thickeners as well. So I guess we can go ahead and start off with microneedling. I'll let you take that.
So I actually have had patients as young as like, I don't know, early 20s, maybe even late teens, like 19, I think. I don't know why that number sticks with me, who have come into the office and gotten microneedling done with me because they have had acne scars.
Yes.
Throughout their entire adolescence. So
to improve skin texture, skin smoothing.
So their acne is now managed. And then the remnants of it are these indentations or acne scar tissue, basically, from the acne. So they come in and they get a series of microneedling treatments done. And because that's the first thing that's like recommended to them by their dermatologist. So they come in and we will typically do it. If they've never gotten anything done before, I'll typically start with traditional microneedling with PRFM because I feel like that PRFM component is a necessity.
It's an amplifier because it's the growth factor from your blood. So you get great results with traditional microneedling on its own, but when we use the booster of your own growth factor, which is platelet-rich fibrin matrix, or PRFM, your results are just amplified, and it's beautiful.
Yeah, so once they get a series of that done, because as we know, acne scarring can take anywhere from 3 to 6 treatments, right? So their second round of treatments, typically I'll talk to them about something like Vivace, which is our microneedling with radio frequency. Because at that point, they're used to, these treatments, so they're used to like the downtime that comes with it. Mm-hmm. So then I'm like, if you want to amplify your results further, think about the microneedling component with the heat from the radio frequency working in different layers of the dermis, stimulating collagen again, plus the PRFM. That's 3 different ways of stimulating collagen. And then you just maintain it, that's the next part, but you just maintain it annually once you hit your goal. So I feel like with microneedling, as young as 19.
Yeah, and you typically don't have to do the 3 to 6 treatments again. It's like you may do 1 to 2 treatments the next year. You may do 1. But usually once you get to a point of optimal results, the upkeep is minimal in comparison to the original treatment plan.
Yeah, and then my other patients that are like in their 30s and 40s, they'll typically start with like microneedling Vivace. They love the Vivace, the microneedling with radio frequency, because they are just looking, they're just looking for that skin tightening and that smoothing aspect that comes with it. So they'll typically do that face and neck area, because those are their areas of concern. So 2 different demographics, two different treatment types that they're looking for. One is more for scarring, the other is for skin tightening.
And then there's microinfusion, which is where we take a microneedling stamper that's attached to a chamber filled with a liquid concoction that we put together at the things we do. And we microneedle stamp it into the skin. And while we're stamping the skin, the stamper itself has these tiny needles that have a hollow pass. And so the liquid concoction is passing through and directly infiltrating the skin simultaneously while you're doing the microneedling.
I wish we could add like a little animation, because that's so... I visualized it in my head.
It's right here.
Animation.
There.
Patrick's like, oh my God.
Your hand's up here, mine's up. It's right here. So that treatment specifically
is I think it's great, because we also like, as far as frequency, let's just talk about frequency too.
Yeah.
Like the do and go.
Yeah.
Once a month.
Do and go, definitely once a month. The do and go is the at-home version of what we do in office. The in-office version you can do once a season as well. So you can do it along with your Botox treatments when you come in. The reason why that one has more longevity is because what's placed in that liquid concoction. So there's a little bit of neuromodulator, there's a little bit of hyaluronic acid gel, so there's a little dermal filler in there, and there's also a little bit of glutathione, which is a super antioxidant that's found in kale and in broccoli, and we have it in our skin naturally, and it helps brighten the skin. So we place that little concoction in office, and then we stamp it in. And then the do and go is if you live in Ohio, or if you live far away from the things we do and you can't get to our microinfusion, our ritual device, our at-home microneedling tool, comes with 4 different skin brews. They're the skin ampules, and you can place it into the chamber before you stamp it into the skin, and that has glycolic acid and hyaluronic acid in it, and it also has moringa, so a different super antioxidant for brightening. So PRFM is next. PRFM, sometimes I feel like we say it so fast and then patients don't know.
PRFM.
Yeah, PRFM. PRFM is, matrix. Yeah, say it one more time.
Platelet-rich fibrin matrix.
Which is the new generation, the next generation, I should say, of what we can do with PRP. So I think PRP has been around for a while. PRP is platelet-rich plasma. It's more of a watery growth factor. We take that watery growth factor, instead of injecting that in and losing so much of it within the interstitial place and extra, the fluid that is within the patient's tissues, it kind of just goes everywhere and you lose its efficacy, which is why you have to place so much in one area and you have to do so many treatments until you finally see a difference. We prefer using PRF. So we take the PRP, and then we also, after the PRP is collected, we place that into a tube that has a lining of calcium chloride, which is a natural mineral that we have in our bodies, so it's biocompatible. And then we take that and mix it a little bit, and the calcium chloride acts as a thickener to the PRP. And so instead of just being plasma, now it's turned into a fibrin matrix, which is essentially your own kind of thin gel made out of your growth factor. So instead of losing that when we place that into your tissues and having it drip everywhere, it is actually turning into a fibrin mucus almost, which sounds so gross, but it's a thin matrix layer that we place in, and it stays right there, and it starts to thicken within the tissues exactly where we want it. So in the under eyes, in the shadows around the mouth, I love to place it in the submental zone to thicken that skin tissue. Usually when patients come in and start that process, patients will come in and ask, like, when can I get PRFM? I say, if you're in your 20s and you have skin, this is a good treatment for you. It's like one of those things that almost everyone can benefit from because it only rejuvenates your own tissue and helps thicken your tissue. It creates new collagen. It makes your skin brighter. It's just overall wonderful.
Well, yes. I think also because a lot of our patient demographic who comes in asking for this treatment, they come in because they want to focus on their under eye area. There may be not a good candidate for filler, or they're apprehensive of getting filler done in that area, or they're like, hey, what can I do to maintain this area before I even have to consider getting dermal filler in that area? And my patients, PRFM falls into their beauty plan regardless of if they do filler. I tell them if there's anything you could be doing for your under eye area right now at this point moving forward, it's going to be this treatment. Because even if we decide to place filler in 5 years, I know that you have done the most for your under eye area in order to create a better home for the filler. So the filler looks better, lasts longer in my opinion. And some patients, they get such a strong collagen response that they don't need filler for quite a while because they've done like a series of the PRFM treatments with us.
You need under eye filler if you have a true significant volume depletion in the under eye zone and in the zone that connects to where the under eye is sloping into the upper cheek area. But for most people who come in and think that they need under eye filler, you really just have some thinning of the under eye skin. And so if that's the case, PRFM truly is the right option for you. It's not filler in the under eye. And that's why we have such great success with treating under eyes at the things we do, is because we're not leaning on just one thing, which is the dermal filler. We're leaning on biostimulatory treatments like PRFM to help you with the under eyes, because for a lot of people, that's the actual option that we should be leaning on instead of something else.
And as far as how often patients should get it done, so like I mentioned earlier, a lot of my patients, because they come in and they want this treatment specifically, and they want to focus specifically on the under eye area, they typically do a series of 3, and they'll either space it out anywhere from 4 to 8 weeks, depending on their schedule, 4 to 8 weeks apart. And then at that point, 1 to 2 times a year. And then I just ask that they have a solid skincare regimen at home, that they're using something specific to the under eye area, like the Youthful Eye Jelly or HA5, something that's going to help that area as well when they're not in office. And then 1 to 2 times a year, I'll typically do this treatment on them once they're done with their set.
I find that so many patients are so happy after 1 to 2 treatments that they get the third, because they're like, I don't want to just do it one more time. And I'm like, you're not going to get like all of a sudden like a 70% rebounding new collagen that you didn't get from the first and second treatment. But if you would like to do another one, you can. But I would stop there and then wait until next year. So it's great. You can do just a couple of treatments. Within the first treatment, though, I will say you will already see a significant difference with the one treatment, where previously when I used to inject PRP, you would have to tell the patients, like, after 3 treatments, you'll finally start to see a difference. Really lean on like the 5th and 6th treatment to really see a difference. And that was really hard for patients and for myself. I knew it was going to happen, but it was hard for me to motivate patients to be like, I'll wait until the 5th treatment to really see a difference.
After getting my blood drawn.
Right. So PRF has been really wonderful for us because of how much of a difference you see within one treatment. And it's something that's so subtle. You can't, ruin a face and overdo it and fill someone and change the, and really augment someone with PRF. It's just not possible because it's not the thickness. It doesn't have the same characteristics or behaviors as hyaluronic acid filler. But it's wonderful if the skin is thinner and needs to be slightly thickened. That it does beautifully. Let's talk about Sculptra. Okay, great. Miss Sculptra Queen. Do you want to?
Acid. I love Sculptra.
You do?
Yes.
I love it too. It's wonderful.
Well, because when I was working in Palmdale, my demographic was 50 plus year old women who probably hadn't used much skincare in their entire 50 plus years of living. And all I could do for them was skin. So that's when I went and took an outside private training and I started learning about Sculptra.
Yeah.
And that was a demographic I treated with Sculptra for probably, oh my gosh, like a year and a half before I started working at the things we do. And then recently we brought it on to the things we do. And I love it because I personally love it for the temple area. I love filler in that area as well. But I think there's something to be said about placing enough Sculptra in there. And you see like this collagen production that almost can somewhat mimic filler in some cases, but it really kind of helps that area have a stronger foundation so you don't have to use so much filler in that area.
Yeah.
As far as
I still do both.
I still do both too, and I
for
tell
someone
them,
who has like moderate to severe volume depletion in the temples, definitely
start with like Sculptra and then work filler in afterwards.
Oh, I do backwards. So I'll do filler
and
then whatever's remaining after I've done like a certain amount of filler in that area, hyaluronic acid gel, then I'll say, you know, like let's top off with some Sculptra. Yeah. But typically I have patients do both. I mean, if you need Sculptra in your temples, you definitely need it in the submalar region, preauricular.
And that's like my second favorite area to treat it, because a lot of patients get, you know, that's where your volume loss starts, right? It starts laterally and we see it more centrally. Yes. So to work on those areas and thicken the skin in those areas, it really has an effect on the central features of the face. So
it's great for people who age in a more gaunt manner.
Yes.
So if you age more inwards and you find that your bony prominences are lacking some soft tissue softness to kind of round things out, then this is a really great option for you. For people who are really round in the face, I don't believe that this is probably the number one treatment I would reach for. Yeah. Because when that person ages, it's more so about aging downwards and dealing with the gel. So I would like things to work with angling more for that person. But for the person who ages inwards, I find that Sculptra is so beautiful.
Yeah, so typically like Sculptra will work right back here in the temple region, basically more laterally, and then something like PRFM all work into the under eyes, the smile lines, because that's just where I prefer PRFM versus, you know, you can't place Sculptra in the under eyes. So
Sculptra typically, I think, to begin treatment, usually around your mid-30s. Mid-30s is a great time to start thinking about it. Also because of the collagen production with Sculptra, you've got to think about in your mid to late 20s is when we stop producing as much collagen, and it slows down every single year. And then at a certain point, we're not producing new collagen anymore.
That's so sad.
So it's great to be able to boost it with Sculptra.
And as far as how often to do it, so 1 to 2 times a year, I think like I always like to refer to stuff like what's an analogy? Is that the right word?
Yeah.
An analogy. So like think about like seeding your lawn, right? When you seed or fertilize 1 to 2 times a year. So that's what you're doing with your face. Not with the fertilizer, obviously, but with Sculptra. You're throwing some seeds to produce collagen. How often do you do that? 1 to 2 times a year. Same thing with Sculptra, 1 to 2 times a year. Most patients, once they get their series and they get their optimal results, I feel like once a year has been plenty.
I think especially if you're starting in your 30s,
yes,
versus patients who start in their 50s and 60s,
they need a little more maintenance.
The upkeep is a little bit more frequently for someone who's more mature. But if you are starting in your 30s and you go a couple of years without doing it, I don't feel like there's a huge shift at all. Like it's just a bonus for you in the future if you keep up with things. So yeah, I think that's perfect upkeep. Let's move on to smooth threads.
Yes.
Smooth threads are so lovely. So the difference, so smooth threads are made out of polydiaxanone. So that's why it's called PDO threads. Smooth threads are also collagen inducers, but are even more specific in as far as placement than PRFM and Sculptra. So if there's a very specific area where you need to build more collagen, you can very accurately place a small grid of collagen building threads or smooth threads and have the collagen build right there. That's why they're so useful for going into the lines on your neck or the neck rings, because you can place them right into those tiny lines and be able to thicken that tissue right there. I love them so much. I would probably consider it around the same time, like early 30s, mid 30s to start doing collagen building threads. And then you can do that treatment maybe once a year after your optimal results are achieved in the first year that you start them.
One thing I want to say about smooth threads, like you said, it's for very it's for very precise areas. So if you're someone who needs like bulk collagen production, typically what we'd recommend is doing something like Vivace, the microneedling with radio frequency first. And then I like to call it like fine tuning with smooth threads.
For bulk collagen production, I thought you were going to say Sculptra to be used all over the face. Yeah. But I do think that Vivace, and then for the more superficial tissues, along with PRFM, and then deeper, I would do Sculptra underneath the tissues.
Do it all.
It's so lovely if you're able to address the more superficial tissues with the PRFM and the Vivace, and then get in deeper with the Sculptra, because now you have this inner and outer help it's that like kind of 3D, shows up.
Yes. Like every different layer.
That 3D.
Yes, like 3D remolding of the tissues. Yes.
Yeah, I mean, strengthening.
Imagine every layer that could produce collagen from all these different treatment modalities is producing collagen. I mean, the end result is beautiful.
Yeah. Yeah. Dermal filler is next. Everyone's favorite hot topic.
Yes. So, I mean, okay, what age did you start? And what was the first treatment you got done with filler?
Well, I think we should talk about how we talked about with Botox, like its different purposes first and really like what your goal is. So with filler, you can address things that are starting to shift because of the pull of gravity and the shrinking and shifting of fat tissues. Or you can volumize a shape that you've never had before and work on really enhancing a shape that genetically, was not yours. So for instance, I've had always a really round face, and I've worked on adding more of a diamond-shaped lower face to what I didn't have genetically to just work on balancing my features. So that is something that I started in my late 20s versus if I was to work on volume depletion for my under eyes, that didn't really become a factor for me. I didn't have to look at those things until after I had my first kid, closer to when I was like 28, 29.
Yeah.
Okay. So if someone has volume depletion, usually that's showing up, one, after significant weight loss. That can happen at any age. Or it can happen because of volume depletion from your aging process and also gravity pulling you downwards. So typically in your 30s to late 30s, that shift becomes more significant. It's different for everyone, but that's the masses. And then if somebody is interested in volumizing, like, working on defining the jawline, working on projecting a chin where someone is softer and recessed in the lower face, or volumizing lip shape that you've never really had, like that type of pout before, then typically you can do that as long as you're 21 and over. We can go ahead and work on it. Yeah, as long as it's appropriate for your features and it balances, the rest of your features and makes sense aesthetically while the aging process progresses. And that's a conversation that you and your provider will have during consultation. But yeah, you can start in your 20s. And then typically the upkeep is once you get to optimal results, you'll most likely upkeep once every 2 years, sometimes every 2 to 3 years.
Yeah.
As there are places in the face that are higher mobility, and we use softer fillers in those zones, like in the true tear trough and in the lips. You will usually retreat that once a year if you want to maintain. You can go a little bit longer sometimes outside of 1 year, but for most people it's 1 year. And then as far as like my chin and my jawline and my outer cheek zone, I usually retreat like once every 3 years.
Yeah, like I'd lasted my cheeks October 2022. So it's been a year and a half.
Great.
And I feel like they're fine. And I work out and I eat really well.
Right.
And I feel like some people just hold on to filler a little bit better. That's been me.
Yeah.
So a year and a half it's been, and I don't really see myself treating it until maybe I'll reevaluate it towards the end of this year. And then my jawline, probably just the same.
Yeah.
Just the same. And it's holding up really well. Lips, I'm just at 1 year. But see, like I ate something salty yesterday and they look a little fuller, so I'm fine with them too. Yeah, so it's relatively low maintenance. Once you do what you need to do, when we say optimal results, we mean a full facial balancing beauty plan. At every year, I'll reevaluate it. I tell patients you'll be coming in for your Botox every 4 months. I'll take a look each time. Some people unfortunately go through a lot of stressors in their life, so you kind of can see it on their face, right? Or they go through some significant weight loss, and it might happen right around the 1 year mark, but typically I tell them we won't pay attention to the area until the 1 year mark. Like I'll really start to take a look.
They'll come in for their Botox treatments. Yeah. We'll see them for their microneedling or PRF treatment. So we're seeing you throughout the year, but most likely we'll tell you after your first filler treatment where we're doing multiple syringes in the jawline, or if we're doing multiple syringes in the cheek area to work on rejuvenizing mid and lower face and under eye area. You won't need that for the next like 2 years. So as we see you for your skin treatments and your skin smoothing treatments, then we'll go ahead and reassess you and take a look at your baseline photos and see, you know what, in about 2 more treatments, in about like 6 months, we'll see if you're due, because I think that we're starting to, now at this point where it's a year and a half out, I think we're starting to see enough metabolization of this product where we're going to need to retreat at this point. So we'll oftentimes give you like a precursor of when you'll be able to need it in the future. Lifting threads are when you have possibly some volume depletion, but more so loss of elasticity in the skin. And what's happening is now you're getting a drop in the tissues, and you're not a great candidate for filling the face for the sake of lifting. So this is a way for us to physically lift the tissues without adding volume in the face. So I've had this treatment done twice. The first time it lasted 2 years. The second time I still feel like I have great results. I haven't needed to retreat yet. It's been 3 years. For most patients, I do find that the time that people start inquiring about that drop in the face is within their early 30s to mid 30s.
And I feel like that's the perfect candidate.
Yeah.
Someone in their 30s, depending on obviously
30s
other...
30s and 40s are great, because when you wait until your late 50s and 60s, there's only so much collagen that we're going to get induced by this treatment. And then also there's a lot more lifting that has to be done. And with threads, we can only lift by a few millimeters, sometimes a couple of centimeters, but it's definitely not meeting the expectation of, sometimes we get patients who are in their 60s and who say, I want to get this kind of lift, and they're lifting their skin and tissues with their fingers by a couple of inches. That's not something we can meet with threads. That's not something we can do with threads. That's really a surgical procedure, and we'll give you our favorite surgical, referral, our favorite surgery referral for that. But it's definitely one of those things where I feel like is great for a couple of millimeters. It's great for patients in our 30s, in our 40s, and the upkeep is once every couple of years.
Once every couple of years. And I think I had one patient who was in her early 50s, and she looked good, but she did have a little bit more laxity than I would have liked. But she was not a good, she couldn't have surgery for other medical reasons. So because I was like, you would be a better candidate for surgery. And she's like, look, I will never and cannot ever get surgery done. I can't do anesthesia. So I'm going to invest what I can in threads. So what we did was we did 1 round of the PDO lifting threads. I waited 6 months because I wanted to see what kind of collagen production she would get. And then I did a second round of threads, and then it lasted 2+ years. It was like
Amazing.
2.5 years. Because once that collagen kind of network of collagen built all around the threads, her skin got a little bit tighter. And then basically like the second time I was treating her 6 months in, it was like her skin was tighter. There was a little bit more lift that can happen. There wasn't as much laxity. And then after that point, it was 2.5 years, and she was good. Yeah. She was good. So there are some one-off cases like that, but I think 30s and 40s is the perfect age demographic for that treatment.
Okay, great. So just to combine all this information and put it in something easy for you guys to screenshot, here it is, right here. I'm just kidding.
Poor Patrick.
I'm just kidding. Thank you guys so much.
Thank you guys.